Alright, so we'll do a ankle taping. So you'd use this in athletes who have had lateral ankle sprains. You can do it for medial ankle sprains as well, depending on what the athlete wants. Generally, I'll start with some foam on the front and on the back. That's there to protect from cuts, where the tape's going to cross over here, prevents any cuts on the Achilles as well. Generally, for a guide, I'll start with an anchor. I like to go about 2 fingers above the malleolus here on the outside. Your first part of the ankle taping is going to be your anchor. This needs to be nice and gentle. If you go too tight over here, what will happen is when the calf contracts and when the athlete starts to run, is you can get some pain and they can start to get pins and needles. So this first anchor needs to be nice and light. Once again, about that 2 fingers above the malleolus. From there, bring your patient or athlete up into about neutral for the ankle. That's going to allow the tape to go on and give a bit of support. I always like to start from the inside going out. Where we're going to start is using this bone here as a guide. I'm going to cut about 50% of that off. So starting out here on the outside, I like to place the tape down. I like to pat it down to start so it fits through there nicely. Coming down, importantly, you don't want any creases on the bottom of the foot because that can lead to blistering. So coming down through here. In between each one, I like to pat down through here just so it sits nicely, so the next layer will sit nicely as well. For your second supporting stirrup, you want to cover about 50%. Same thing, laying that down nicely. This doesn't need to be too tight, just tight enough that it sits on there nicely, but you're not providing too much support through this one here. Once again, I like to pat that down, and that's your 2 stirrups. Going from there, making sure they don't lose that ankle position. There's 2 ways to do your figure 6s, which is the next point. One, starting from here, coming up around through here. How I prefer to do it and how I find I get the best results. Starting from the inside, starting here at the top, coming across, making sure you don't cut off this little bone here to stop people from getting pins and needles. Once again, coming around and through, chopping it off here, and then just laying that down. How tight you want this to be will depend on what you're trying to strap for and the athlete's preference. So how I like to do that is one on this side, then one on that side. Same thing. And if you find that with your taping, let's say you come up a little bit too high, you can gently peel it off and come through there. Seeing there that I got that little bit of a crease and I'm able to work that out through there. So we'll do 2 of those once again, starting from inside and then going to the outside. Throughout this process as well, you want to speak to the athlete or the patient and just make sure that it's not too tight. I like to speak between each layer to make sure I'm not cutting off any circulation or anything similar. So that's our 2 figure 6s. Some athletes will be comfortable with that. How you test that is just support through the tape and just have them move their foot in and out. And you'll see that provides a little bit of support there. So that's your basic ankle taping. What I will then add on from there is your figure 8s. So how these start is inside, goes around underneath the Achilles, onto this side, around the outside of the ankle, up to where it starts. And then on this side, coming down underneath, up, across here, and over the top. So underneath, across the back of the heel, up, and across the top. And we'll go the opposite way as well. what you're looking for is any little holes or anything through here. Any holes can cause any blistering and that kind of thing. So I always like to have a bit of a look, and if I need to, you can just place a small bit of tape over those bits of exposed skin just to stop any blistering. So through here. And then to finish it off, it's locking off at the top. So same thing as the anchor, across. And that's ankle taping.